Lymphatic system. Lymphatic. Lymphatic. The lymphatic system, figure 613, is a collaboration of organs, tissues, also known as nodes, thin-walled vessels, and fluids that are found throughout the entire body. One chief function of the lymphatic system is to capture fluid, called lymph, that escapes from cells and tissues and return it to the bloodstream. In this way, the lymphatic system functions to maintain a balance of fluids within the body. The associated lymphatic organs also have an immune function, producing lymphocytes and other white blood cells that fight infection. In fact, the lymphatic system is a critical part of the body's immune system. Lymphoid organs include the adenoids, tonsils, spleen, and thymus. Some sources include the appendix as a lymphoid organ because of the density of lymph tissue found there. The lymphatic system also consists of nodes, commonly referred to as lymph nodes, that are normally soft and round or irregularly shaped. These nodes filter lymphatic fluid of bacteria and foreign cells, as well as making lymphocytes and other infection-fighting cells. You may recall your physician feeling the lymph nodes in your neck. He or she was looking for enlargement, which may be a sign of infection. Women who have had a breast removed, such as a total mastectomy, because of breast cancer, will often be instructed not to allow a blood pressure to be taken on the arm on the same side as the mastectomy. This is because a mastectomy often includes removal of lymphatic tissue from the armpit area. The compression of an inflated blood pressure cuff on the upper arm can potentially damage the fragile remaining lymphatic tissue. As an EMT, you must avoid taking a blood pressure on the side of a woman's body where a mastectomy has been performed. All of this last paragraph relates to Aunt Megan, who had cancer in her breast and had a mastectomy and now has a lot of problems with that arm and the lymphatic system, including her lymph nodes in the armpit and the arm near the breast that was affected. So if you would like to know more about that and use it to help you memorize this, talk to Grandma. Nervous system. The nervous system in figure 614 consists of the brain, spinal cord, and nerve tissue. It transmits impulses that govern sensation, movement, and thought. It also controls the body's voluntary and involuntary activity. It is subdivided into the central and peripheral nervous systems. The central nervous system, CNS, is composed of the brain and the spinal cord. The brain could be likened to a powerful computer that receives information from the body and in turn sends impulses to different areas of the body to respond to internal and external changes. The spinal cord rests within the spinal column and stretches from the brain to the lumbar vertebrae. Nerves branch from each part of the cord and reach through the body. A key function of the central nervous system is consciousness. The reticular activating system is a series of nervous pathways in the brain and is essentially responsible for keeping one awake. The peripheral nervous system, PNS, consists of two types of nerves, sensory and motor. The sensory nerves pick up information from throughout the body and transmit it to the spinal cord and brain. If you touch something hot, your sensory nerves transmit this to the spinal cord and brain, so immediate action may be taken. The motor nerves carry messages from the brain to the body. The autonomic nervous system is the division of the peripheral nervous system that controls involuntary motor functions and affects such things as digestion and heart rate. The autonomic nervous system can be further broken down into the sympathetic and parasympathetic nervous systems. The sympathetic nervous system function is often referred to as the fight or flight response, as in you're going to fight somebody or you're going to fly away, flee the scene. This system is engaged when the body is in crisis. Stimulation of the sympathetic tone causes the heart to beat faster, the lungs to breathe deeper, and the blood vessels to constrict. Imagine all the responses you might need if you had to run away from a potential threat. The parasympathetic nervous system asserts an opposite effect. It is engaged in times of relaxation and is often referred to as the feed or breed response. So eat or have sex, basically. Parasympathetic tone causes increased blood flow to the digestive tract and to the reproductive organs. It can also cause the heart to slow down and the blood vessels to dilate. The digestive system. The digestive system provides the mechanisms by which food travels through the body and is digested or broken down into absorbable forms. Food enters the mouth and is broken down by both saliva and chewing. The food passes from the mouth through the oropharynx and into the esophagus, where it is transported to the stomach. Except for the mouth and the esophagus, all of the organs of digestion are contained in the abdominal cavity. Stomach. The stomach is a hollow organ that expands as it fills with food. In the stomach, acidic gastric juices begin to break food down into components that the body will be able to convert into energy. Small intestine. The small intestine is divided into three parts: the duodenum, the jejunum, and the ileum. This organ receives the food from the stomach and continues to break it down for absorption. These nutrients are absorbed by the body through the wall of the small intestine. Large intestine, also referred to as the colon. The large intestine removes water from waste products as they move toward elimination from the body. Anything not absorbed from this point is moved through the colon and excreted as feces. Several organs located outside of the stomach and intestine continuum assist in the food breakdown process. The liver. The liver produces bile, which is excreted into the small intestine to assist in the breakdown of fats. The liver has many additional functions, including detoxifying harmful substances, storing sugar, and assisting in production of blood products. To review some terms: digestive system. System by which food travels through the body and is digested or broken down into absorbable forms. Stomach. Muscular sac between the esophagus and the small intestine where digestion of food begins. Small intestine. The muscular tube between the stomach and the large intestine divided into the duodenum, the jejunum, and the ileum, which receives partially digested food from the stomach and continues digestion. Nutrients are absorbed by the body through its walls. Large intestine, muscular tube that removes water from waste products received from the small intestine and moves anything not absorbed by the body toward excretion from the body. Liver, the largest organ of the body, which produces bile to assist in breakdown of fats and assists in the metabolism of various substances in the body. Inside, outside. Recognizing sympathetic nervous system response. Recognizing a sympathetic nervous system response can be an important part of a patient assessment. Often, a patient's sympathetic nervous system will be engaged as the result of injury or illness, and recognizing its signs can help alert you to a problem, even when the immediate cause is unknown. Let's use the example of a 62-year-old male having an acute myocardial infarction or a heart attack. Inside. In this patient, something very wrong is happening. Coronary artery is blocked, and his heart is not getting the oxygen supply it desperately needs. In most people, this will cause chest pain, but in this case, the patient is diabetic, and for an unknown reason, no chest pain is present. He does, however, feel weak and nauseated, like he's going to throw up. Despite his obscure symptoms, his body is reacting. His brain engages the sympathetic nervous system to respond to the challenge. His heart beats a little bit faster. He breathes a bit quicker. His blood vessels constrict and divert blood away from the skin. Outside. Although he is presenting atypically, that is, in an unusual fashion, your assessment reveals a few red flags. You notice he is pale and sweaty, a result of constricted blood vessels. You also observe the elevated heart rate and respiratory rate. By noticing these signs, you recognize a sympathetic discharge and know that the body is responding to a serious problem. This may be more than an upset stomach.